two. So we've got mint and
Coffee grounds.
coffee grounds would be another. Okay. And I do have my stethoscope and I do have my pen light. Oh, it's not my pen light, but we're gonna act like it is. So we just have a okay. So I've already knocked, washed my hands. I'm gonna introduce myself. Hello, my name is Chris. I'm gonna be there taking care of you today. Is there anything I can help you with right now?
No.
Okay, perfect. If it's okay with you, I'm gonna go ahead and do just a quick head, ears, eyes, nose, and throat assessment.
Okay.
Perfect. Go ahead and give me your armband real quick. And can you tell me your name and date of birth?
Casting number 123191.
Babe.
No, that's not quite it. That is it.
Baby. It's okay. Alright, so I've introduced myself, I verified my patient's identity. Anything else I need to do before I get started with the actual assessment part? Can you tell me where you are today?
I'm at the Eclipse Hospital.
Okay. And what do you know why you're here?
No.
Do you have any allergies?
No.
No? Perfect. If she did have allergies, what would I want to follow up with?
What she's allergic to.
What she is allergic to and what her reactions are to that. Okay? Alright, so now I can go ahead and start with my little consciousness we've just done. General survey, she appears to be clean, well groomed. Her clothes aren't disheveled, ripped, torn, stained. Looks pretty good overall. Okay. Measures vital signs, so I've already reviewed your vital signs before entering the room, and they were all good. Nothing to worry about in that aspect. So now I can really, now that's the first 8. So now I can go into assessing her head. So I'm going to look at it and see if it's nice and symmetrical, which looks normocephalic to me, so expected. All right, now I can palpate. She's like, oh.
I know. I thought my head being
Okay. See if there's any bumps or anything like that. Any ports on the back of the neck? No, just kidding. Matrix?
Oh,
Right.
memory upgrade.
Totally.
Nice.
I need to go from a gigabyte to a trigabyte or whatever is next. Right.
Terabyte.
Trigabyte. What's the next one for gigabyte? Tetrabyte. Okay. I know it's TB, which would be tuberculosis.
Oh my God.
Okay. Didn't feel any lumps or bumps when I palpated her skull, so that's all intact. There's no lesions. She has more than enough hair. A little bit of a dry scalp. We won't mention that. Okay. Also looking for symmetry in her face. Her eyebrows are even. They're cousins now, not twins. Eyes are on the same plane, so they're not tilted or anything like that. Nose is midline. Mouth is midline, but she just keeps laughing at me, but that's okay. Her ears are adequately set where they're supposed to be, so they line up with the outer canthus of the eye. And there's 2 of them. Lobes are both pierced. Looks like three times on that ear. 1, 2, and 2 on that ear. Is that correct?
Mm-hmm.
Okay.
How are you counting?
Huh?
What are you counting?
Ear piercing.
Ear piercing.
Oh.
Yeah. She's got 2 piercings here, 1 here, and an opening. And then on this here, she's got the same on the lobe, but then she's got 1 up here. Okay. Go ahead and open up your mouth for me. Nice. Tongue is nice and pink. Mucous membranes is.
I brushed my teeth.
Mucous membranes are nice and pink. Teeth are white-ish. They're not. They're not
Pearly
bleached
white.
white, like I said, but they're the shade that they're supposed to be. Okay. Tongue is not furrowed. It's relatively smooth. It still has some texture to it. Can you tilt your head back for me and look up her nose here and see if I can see any obvious obstructions, which I do not. All nice and clean. Her eyes are nice and clear as well. I'm going to go ahead and just peel these down for a second and look at her conjunctiva, which are nice and pink and not dry or anything like that, so that's good. All right. And I feel for some lymph nodes. And I start right behind the ear, work my way forward and then down. So I'm gonna start here and see if I can feel anything. What is this? Is that a mole?
Yeah.
Okay.
I was like, I don't know what is this. I gotta go to the doctor and figure out.
That's why she volunteered. She's like, ooh, free exam.
I know.
But I don't feel any lumps or bumps here. I'm gonna feel along the side here. Now notice I'm not feeling for her carotids. So it's okay that I'm doing both sides at the same time. Okay? And then I'm gonna feel down here. I would feel directly on her skin, but I'm not gonna peel that down right now, but I still don't feel any lumps or bumps up here, so that's good. Now for this next part, for the thyroid, like I said, it's easier for you if you come around to behind your patient. And just kind of feel for that prominent part of the Adam's apple or the trachea there. So I found it right where my middle finger is, so then I can come off to the side and feel around it. And I can feel the thyroid right in this area, just a little bit below it. Okay, and it feels pretty much the same on both sides. Yeah. Okay, nothing crazy or anything like that. All right. Then, whew, I'll take the skull and neck in here. We did that. Oh, okay. Check for range of motion of the neck. So I'm going to have you look up and down a couple of times. And I'm going to take your stethoscope off. Even though you're a patient right now, you shouldn't have one. Look, I can do that again. Up and down, side to side. Perfect. And what I'm feeling for is for any grinding or crepitus as she moves her head side to side or up and down. Okay. I don't necessarily have to have her do this part yet, but if she was having stiffness in either of those directions, I would then have her do that. Okay. All right. Assess lymph nodes, check the thyroid. All right. Testing cranial nerve 5, having the patient bite down. Bite down for me. Okay, and I'm feeling back here to see that that masseter muscle is engaged. Okay, so if you were to do this right now, you'll feel that muscle engage. Okay, that's what we're checking for. We're also going to have them close their eyes as tight as you can. All right, open them up. Eyebrows nice and high. Puff your cheeks out. Smile. Keep your eyebrows up. I didn't tell you to put them down yet.
Simon says.
And that's your mom face. All right, close that. Report touch. So this is where there was a little bit of that discrepancy, because I did say you could use a cotton-tipped applicator, but you have to break off a little wisp of the cotton, okay? Just the one little fiber of cotton, and then have that to go, have them close their eyes and have them tell you where you're touching. So for this one, you would touch like the forehead above the eyebrow, the cheekbone, and the jaw.
Each
Okay.
spot? Or just one of the braces?
One at a time,
And
on both sides.
that's checking for what?
Cranial nerve 5.
And it was touching the cheeks?
The cotton touching just above the eyebrow here up on the forehead. If you almost think of like a 3,
Okay, perfect.
that way it's the eyebrow, the cheekbone, and then the jawline. Okay? So if I had the cotton tipped applicator, I'd have her close her eyes and I'd be like, tell me where you feel this. And I would just do a little bit of a grazing.
Eyebrow. Cheek. Jaw. Cheek. Eyebrows. Jaw.
And now I know that all of cranial nerve 5 is intact. I had her do facial expressions, frown, smile, and puff her cheeks, so that would be for cranial nerve 7. Cranial nerve 11 would be having her turn, well, we kind of already assessed that because we had her turn her head side to side. The other way you could do that too is lifting the shoulders up. That's for your accessory. Number 11. Yes. Okay. Inspect the eyes and areas surrounding, including hair, eyelashes, and any dripping of lids, color, sclera, or inflammation. So her eyes are kind of like a light bluish gray. Her sclera is nice and clear and white, like it should be. We looked at her conjunctiva, it was nice and pink. Eyelashes are plentiful, eyebrows are fine. Like I said, they're cousins now that I know that term. Okay. No drooping lids were noted, no inflammation. We already retracted her lower lids, so we're good there. So now, inspecting the iris, pupils, noting size, color, and shape, and progressing to perla. So now that's where this lovely guy comes out. Okay. So, can somebody turn off the overhead lights for me, please?
Dun, dun, dun.
Dang, it was still light enough they can see me. Okay. I was trying. All right. So, first step that I'm going to do is, again, you do not want to just shine this directly in the person's eye. Okay? Is that comfortable for you?
No.
And it's definitely not going to be comfortable for them. And if they're sick or if they have like a massive headache or anything, you cause everything to be just much worse. Okay? What you need to do is just kind of go across the eye a little bit to kind of get a response, but not directly like this. Okay? So if you guys come and watch, you'll see Cassidy's pupils constrict as it's exposed to the light. Ever so slightly.
Oh, that's crazy.
Okay. Now, we're pretty good on this one, right? So we need to actually watch this one, even though we're shining the light over here, so that way we can see if they're both responding at the same time. Okay? And then I saw that both of them were, so now I'm going to come over to this side and stimulate it directly. That one changed, so I can come over here, flashing it over here, but watching over here to see if it happens as well.
Could you do underneath as well to see both?
Mhm.
Or?
Just as long as you're getting eye or some type of light on the eye.
I mean, like,
You just don't want to go direct. Yeah.
What I mean is like come over here.
No, you need to be a little bit closer.
Oh, okay. I'm just saying, like, if you can't like see it, like you just like I don't know.
Yeah.
Okay.
Good.
Good.
Okay. So now we can say that her pupils are equal, round, reactive to light, but we can't say accommodation yet. We still got a step to go. So now we can move on to our 6 cardinal signs of gaze. So I'm going to have her stare here at the tip of the pen light, and I'm going to go to 6 different places. But I'm always coming back to her nose. And then now, once that's done, I'm going to say continue to watch the tip, and I'm going to go towards her nose to make her cross her eyes, and then back. And then I can tell that she is now accommodating. She's able to accommodate for depth. Okay? And her all cardinal signs of gaze are intact. Okay? So that would be number 16. So with those cranial nerves, we've done 3, 4, and 6. Ears, we kind of saw earlier that they are, sorry, I'm going to tuck them out, sorry again. But they're about level with her outer canthus of her eye, so that's good. I'm going to look for any type of drainage or anything. If I did see drainage, I would want to palpate what? Her tragus, to see if there's any pain or discomfort or hell away from me. Okay.
Like, is there flying?
Right. Then I already inspected her nose earlier and said that it was what? Midline. That's it. I looked up her nose and saw that there was no obvious obstructions. Can palpate the ears. You can see again if there's any lumps or bumps or anything like that out of the ordinary. Because if you've ever watched Dr. Pimple Popper, you can see that sometimes people will get ingrown follicles of dirt and dead skin and then let's see, percuss over the mastoid process. Percuss does not necessarily mean,
Dang.
you know what I mean? When we get to the chest, you will have to do this.
Yeah, but like
For
that's so
percussing.
aggressive.
Mhm. But back here, just like earlier today when I showed you guys as far as palpating the sinuses, okay? When I was doing that on Indira this morning, it's just going like this to see if you are eliciting a reaction from your patient. It's not like that, you know.
You gonna get a reaction.
Oh yeah, you're going to
Trust but
I'll
verify.
be singing a lot higher, I'm sure. Okay, I'm already a 10er. I don't want to go any higher, but I want to come back here to the mastoid process and see too if there's anything, if it's chipped or if it's painful. Because if she's hit her head and she hit it right there, she could have chipped that. And that's going to be very painful every time she turns her head, because that's where that ligament, the cleidomastoid process, or the cleidomastoid muscle, helps to turn the head to that side. So, all right, test hearing. That's the very, very scientific whisper test. Okay, so.
Oh, sorry.
Find something quick.
1, 2, 3.
Very scientific.
ABC.
All right, perfect. Hearing is intact. You will know, or will need to know for the exam, the difference between the Weber and the Rhine, which I did not get a chance to look up at during lunch, but I will have it for tomorrow. As far as those are, know that of course the Weber is the one that is up here, and it's for sensory neuro or conductive hearing loss, and then the Rhine is the one where you put it on the back of the mastoid process, have them count until they no longer can hear it, and then you move to air conduction, and then bone should be half or twice as much as air conduction. Half. All right, otoscope. This is where I would take my otoscope and pull down and back.
Up and back. Oh, goodness.
You.
And I would actually put that little part in the ear and visualize, or at least I'm trying to visualize the tympanic membrane to see if it's pearly gray and clear. And I would check both sides.
How far into the ear?
Pardon?
How far into the ear?
You usually go until you see it. I wouldn't say it's not very deep. Like if you're all the way to the bottom of that thing, you're too far. You only need to just make sure you can see that it's clear and that it's pearly. That's about it. All right. I looked up her nose, but I'm going to get really close and personal. Go ahead and tilt your head back and look up there. Oh my God.
Should I sit it right here for you?
Dude, you might just want to
Ew.
snot rocket that thing right across the room. Let me turn around.
And make sure that you do adequate sound effects.
All right, and with that, I am looking to see if there's any deviation or anything like that. I don't see anything. Okay. Let's see, septum, nasal mucosa. Have patient identify sent to check for cranial nerve 1. Again, if you don't do that with this one, that's okay.
Okay.
Okay. I would be more strict with that for the neurological one towards the end. Okay. If you do it, great. If not, don't. I'm not going to penalize you for it at this stage. Okay. So we got that, and that's when you would have them close their eyes, cup of coffee, have them identify it with one nostril versus the other, and then change to see if they can name the same thing. Change the scent in between nostrils. So have them do coffee and then toothpaste, and then toothpaste and coffee or whatnot. We've already assessed the mouth, the lips, oral mucosa, gums, and teeth, which we said were all good. I did not get a chance to assess her tonsils because I didn't have this. So I'm going to open up again, nice and big. Go ahead and say, ah. Oh my goodness, your tonsils are back there still.
Yeah.
Yeah.
I've never had an ear infection either.
Ooh, knock on wood. When we
Tomorrow
have our
I get
patients
strep.
say, right, when we have them say, ah, it's to see if that uvula moves. Okay, exactly. All right.
Sorry.
Now we've done that, so we want to assess our patient's ability to swallow. So I'm going to put my fingers just over and have her take a dry swallow. If I have a glass of water, that's what the cup of water is for. That's great, as long as they're not NPO. And you're just trying to see if the larynx moves up and down like it's supposed to.
This is a lot.
Oh, this is nothing. Wait until we get to neuro and
Oh, the
muscular. Those are
pages.
two separate. It's too full, front and back.
Oh.
So it's a little bit longer than this. A little bit. And then finally, that's actually the last step. We need to make sure that our patient is safe, bed is lowered and locked. call bell within place, belongings within reach.
Thank you for your time.
Mhm.
And then,
Well, and also too, I will say, a lot of hospitals, they're very customer service centered, patient satisfaction scores, all that fun stuff. So one of the other things that you might want to follow up with your patients is if there's anything else I can do for you while I'm here, I have the time. Even if you have another patient that's trying to climb out of bed or whatnot, here in the NCLEX hospital, you have plenty of time and no distractions.